And of course it is refundable, meaning that if there's no tax due, you're going to get money back from Uncle Sam for providing this health insurance. And by the way, this part of the law took effect January 1st this year, even though the legislation wasn't signed into law until March 23rd. So essentially all of the premiums you pay in 2010, 11, 12, and 13 are eligible for the small business tax credit. Very good credit. I like it a lot. It's not going to help every business, but hey, if you've got questions about it, give me a call. I'll do anything I can to help you with it. Premium subsidies. That's the next option, or the next component that we'll talk about today, is how are they going to get all of those people above 133% to buy insurance. They're mandated, right? We'll talk about the mandates in a minute, but there's premium subsidies available for those earning between 134% and 400% of the federal poverty level. That would be the singles earning up to $43,280 a year in income. And for a family of four, that means an income of less than $88,200. Well, these people are going to get help paying for their health insurance. So how does that help work? An exchange subsidy example would be a family of four earning $55,000 a year. That's $4,853 a month. And I got to tell you, that's a meager existence at best. We all know. I mean, it costs a lot of money to live in this society we have now. The federal government estimates that the bronze level plan will cost $13,500 effective January 1st of 2014. Now that's an estimate. We don't know how much it's going to cost, but that's what they have as a target. The maximum that family of four can pay towards the cost of that coverage by this law. I mean, this law dictates how much they can pay for insurance. And the maximum is 8.1% of their income. That means that this family will pay $4,455 a year or $372 a month for the cost of coverage. The exchange-provided subsidy is double that. It's $9,045 a year or $754 monthly. That's a pretty good piece of help for that family of four making $55,000 a year. So let's talk about exchanges. I've mentioned that a couple of times now. An exchange is basically just a web-based marketplace. They must be operational by January 1st of 2014. Again, that's the platform with which they're going to deliver these subsidies. They're independently operated by the states, although states can partner with other states to combine their efforts. So it's very possible that we might have Texas and Alabama and Mississippi combined to come up with a southeastern regional exchange. That's very possible. One thing that I want to make sure everybody's clear on is there is no public option, at least not currently. Now that might change at some point in time, but as it's written now, there is no public option as part of the exchange. Now states may operate a separate exchange for individual coverage and small group coverage, and small groups in the legislation are considered those with fewer than 100 employees. Now they can also combine the two exchanges into one if they feel that that's more cost effective. And we really just don't know how this is all going to look. The legislation, again, just provides the frameworks. It's not dictating to the states how they do it. It's just giving them guidelines they have to work within as they put it together. Now, when we talk about the exchanges, it's important that everybody understand that coverage can be purchased in or out of the exchange. Well, if you buy it in the exchange, you can get it with subsidies, or if you don't qualify, you can still get the coverage through the exchange. You don't have to. You can also buy the coverage outside of the exchange. Of course, if you qualify for subsidies and you buy insurance outside of the exchange, you won't get those subsidies. So you have to buy the insurance inside the exchange to get the subsidies. You can also buy the services. You can buy the insurance with the service of an agent, or you can buy it without an agent. It doesn't matter. The premium is going to be the same. Very important. Promise. If you like what you have, you can keep it. Anybody remember hearing that over the last 18 months? Well, let's talk about that. How did they provide for that? Grandfathered plan status is available to anybody that had coverage in force on March 23rd of this year. Doesn't matter whether it's individual coverage or group coverage, you can grandfather your plan status. Well, let's talk about that. Why would you want to grandfather your plan status? You know, a lot of people hear about this legislation and they say, well, I don't want any part of that. Well, is that based on just what you think or what you know? Because at the end of the day, that's really what's going to make a difference. The biggest and most compelling reason that I can come up with for anybody to consider grandfathered plan status is the non-discrimination rules. Because effective renewals on or after October 1st of this year, you have to comply with non-discrimination rules. The same non-discrimination rules that apply to pension plans are also going to apply to health insurance, fully insured health insurance. I have a group downtown that's a very well-known restaurant. They've got about 30 employees. They only have 5 on the group coverage. And the reason they only have 5 is they only make the coverage available to the owners and management. Most of the employees are fairly transient in nature, low-wage earners, they qualify for Medicaid, they don't want to pay their share, whatever. This is a discriminatory group. This group definitely has a very significant reason to consider grandfathering their coverage. And that's exactly what they did when I reviewed their options with them. The other things that would not apply to groups that protect their grandfather status would be limits for pre-authorization requirements, which very rarely creates problems in my experience, an expanded appeals process, limits on out-of-pocket expenses and cost sharing would not apply to those plans that are grandfathered. But the most significant thing, other than the non-discrimination, is the first dollar benefits for an expanded list of preventative services that include all U.S. Prevention Task Force grade A and B schedules. Now, you may remember hearing back in October last year, there was quite an uproar amongst the women because the USPTF decided that no longer was mammograms necessary automatically. Does everybody remember that? Well, it didn't take much of an uproar from the women for them to reverse that. And that's the most recent exposure to the USPTF that I heard until I finally saw what this Schedule A and B includes. And not only does it include the things that we all know and love and consider prevention, like colorectal screenings, the annual physicals, mammograms, blood work, the kind of stuff that typically does not apply to deductible and co-insurance, but it includes things like obesity counseling, depression screening, tobacco use counseling. I'm a big believer in prevention and preventing problems before they become a problem, but does all of this stuff have to be covered 100% with no deductible, no co-pays. I mean, basically, it'll be free, covered by the insurance. Now, that's all well and good, but we have to understand that this is going to affect the cost at the end of the day.